Test-taking strategies for nursing students. Choosing the right answer involves choosing the best of several answers that have correct information. You may have to analyze and interpret what the question is really asking. In order to do this, you need critical thinking skills. You need to evaluate your question. Recall questions are the easiest ones to answer because you can just find the familiar term. So the example here is about a percutaneous liver biopsy. If you knew hemorrhage was the concern, you just have to find that answer and plug it in, and you're good to go. Recall are easy. Remembering or memorization allows you to recall. You may be able to recall something and understand a little bit about it. Understand about hemorrhage. If you know that signs and symptoms of hemorrhage are vital sign changes, they're blood coming out of the body, right? So in order to have blood coming out of the body, it might be near large blood vessels. So if you understand something about hemorrhage, you'll be able to get an understanding question. So you have to know something because what you've recalled isn't listed. You have to be able to translate that and use your critical thinking skills. Then there are application questions. So again, you have to have a level of understanding. We already know after a percutaneous liver biopsy that hemorrhage is something that you're concerned with. So in order to apply that knowledge, you have to know that vital sign changes can show you hemorrhage. If you're not seeing active bleeding, vital sign changes are what you look at. That would allow you to apply the knowledge that you recalled to answer those questions. And then there are analysis questions where you really have to pull the information out. So in this example, it's asking you about a drug. It's asking you what diet for somebody who's on this drug. You have to know that there are no dietary restrictions for somebody on the drug. Most students would think this is a trick question. It's not. If there are no dietary restrictions, you can still help them choose a diet. You just choose the healthiest diet. And then you get the answer correct. Now, before you think about what I just said, recall, application, analysis, these are just types of questions and tools that you have to use in your brain to be able to answer, right? So you have to know a little something. You have to translate what you're studying into something that you understand. Don't just try to memorize. You won't understand it. You might get lucky and be able to recognize something familiar. But if you're trying to understand something that is a whole page in a book, for example, even if you only understand 25% of it and translate it into your own words, you'll be better equipped to take a test. You'll be better equipped to identify the right answer. Some people need to visualize things. They need to imagine themselves going through the motions of performing an activity. So when you're taking a test, don't rush through, don't look at the words, close your eyes and visualize. It is proven that it will help you, especially for you visual learners. So this slide looks like total common sense, right? Becoming a better test taker, strategies that don't work, cramming. Cramming never works. Choosing the same answers, answer C. I can't believe people still do this, but they do, and it never works. So what you have to do is understand the content. Translate things in your own words on the note cards that you make or the notes that you make. If your teacher touches on a topic, write down that topic. Don't write word for word, and go back and look it up and try to understand it. Read that section in your book. It will help you so much if you can translate it to your own words. And just allow time for studying. Maybe study in a group. Ask each other questions. Listen to your students. Listen to your fellow students as they explain how they understand something on a topic that you don't understand. Help each other. And then you look for clues in the questions. So nursing questions have a hierarchy of what's the most important, okay? We start with Maslow's hierarchy. Maslow's hierarchy, physiological needs come first. Psychosocial needs are higher up on the chain. They are not important. So if somebody's screaming in pain, but they just had a heart attack, or they need to have an airway put in because they need to breathe, we don't care about the pain. It's the breathing that we deal with. Does that make sense? So Maslow's hierarchy. And then we look at the nursing process. So if there is a, what would you do first? The first thing in the nursing process is assess, diagnose, right? So we would assess. That would always be the right answer. So I have some students that do well, and they make themselves a little note card, and they do Maslow's, they do nursing process, they do safety. So categorize your questions. Let's take a look at this one. So all answers look correct, right? Everything looks correct. Newborn baby, jerky movements. The mother had it's gestational diabetes mellitus during pregnancy. What do you do first? All these things are right. Part of your assessment is determining the blood glucose level. Nurses can do this without a doctor's order, so you would validate your assessment, and that's first. First thing in the nursing process. There's also positioning questions. You want to prevent or promote? Think about that. What's the question asking you? Now, when there are questions about communication, I want you to memorize all of these answers that are inappropriate. You never tell the patient, don't worry. You never ask them why. You never tell them, don't think, authoritarian answers would be like, we're not going to do that. We're not going to talk about that. We're not going to go there. We're not, just any kind of dictatorship answers. We don't do that. Closed-ended questions, what would that mean? You don't want a yes or no. You want them to explain. So communication questions are going to be empathetic and supportive. If they're not, they're wrong. The doctor says so is always wrong in a question. So you do Maslow's hierarchy, nursing process, anything about safety. Safety's first. Positioning, prevent or promote. Communication. Here's Maslow's hierarchy. Here's the nursing process. So in order, the first thing, second, third, fourth, fifth, okay? Here's some sample questions. So, patient goes to the ED, they say, I'm scared, I think I'm going to die. What do? You go back to this. I'm not going to say don't worry. I'm not going to ask why. I'm not going to be authoritative, right? So everything's going to be fine. We're going to take care of you. I know what you mean. You turn yourself into the patient. Say, I thought I would tell them about your history. I'll call the doctor. I'm out of it. Or do you do the therapeutic? It's normal. We're doing everything we can. You're not promising them anything. D is the correct answer. Nurses get those wrong. Okay, here's another one. So the recall question, if you study lumbar laminectomies, you know that you have to log roll a patient. So close your eyes and visualize how to log roll a patient, okay? And then look at these answers. Can you log roll if a head of the bed is elevated and they lock their knees? No. Pillow between the legs, body turned as a unit? Yeah, that looks good. That looks like it's describing log rolling, so that's probably the right answer. Let's look at the next one. If she straightens her back, grasps the side rails on the opposite side of the neck, that's doing a spinal twist. Totally not log rolling, so that one's not right. D. The head of the bed is flat. She bends her knees and rolls to the side. This one is similar to log rolling, but she doesn't have her pillow between her legs, which would protect her hips from turning. Because if she bends her knees and rolls, her knees will be will go first, right? So B is the right answer. Do you see how recall, and then you have to kind of understand that in order to describe it or visualize it to get the right answer. Here's one. So, appendectomy patient. Patient has pain, but they just received the medication. So what would the nurse do? Give him something to read so that he's distracted? Maybe. Massage his abdomen? We know that's not right. Place the patient in Fowler's position. For you 120 nursing students, you probably don't know what Fowler's position is, but it's sitting up. That's going to make the patient more comfortable, believe it or not. Positioning is. So that's the right answer. You would never just notify the physician because the analgesic is going to kick in soon, and they won't need to bother that physician. Okay, here's another one. Kid's riding his bike. I think my leg is broken. What do they do first? There's only one assessment answer, and that is it. You assess that patient. These seem pretty easy now, don't they? All right. I'm going to stop this video, and I'm going to do one more video with just some questions and answers for you. And we're going to, hopefully this will help you. So I hope you watch the next one.